I would like to talk today about the Zolid HT Plus mainly. We'll also roughly go around different Zirconia's options about workflows, digital designs, and all the options we have on a daily basis. I want to start with the digital dentistry, and when we utilize Zolid HT Plus, we definitely have to utilize digital devices. We have to use scanners and milling machines, and that's just the nature of Zirconia, what it brings with it. And looking at monolithic or looking at digital restorations, we're also looking at monolithic restorations. And a huge advantage of monolithic restorations, of course, it's strength. That's what most of our customers looking for. They're calling us, hey, I need a very strong ground. It's a Bruxer patient and everything else chips and cracks and so on. So can you give me something very strong? And usually we dive in and say, oh yeah, of course we can do Zirconia. I mean, there are many other options. I don't want to say Zirconia is the material we all have to go for everything. There's always the right material for the right patient or for the right case. But definitely Zirconia is a valid material, and we definitely like Zirconia. I'm using Zirconia every day. So let's just look at some reconstructions. That's kind of something very typical where almost everything started the single, basically full contour Zirconia posterior crowns. Yeah? And you can tell these are a little bit more opaque looking. They are not layered. They're full contour Zirconia. There used to be Zolids, and Zolid already gave us a nice aesthetic, and they look nice. I mean, there's nothing wrong with, but I'm pretty sure we can do better. Or we're looking on to full arch reconstructions. So both restorations totally different, yeah, but they have something in common. They are both full contour, except of here I have to admit that is the pink is layered, yeah, but anything else is full contour, full anatomic, designed, milled, stained and glazed, yeah, as well on this restoration. So that's what these both restorations have in common, even if they're so different. If we now look a little bit on the history of our restorations on statistics, you see the pink line that gives you an overview about monolithic all ceramic materials, not just Zirconia, lithium disilicate as well, just to see how skyrocketing the numbers are just going to be in compared to PFM on the green line. You see it's just falling down kind of slowly but surely more and more. Also, I have to say I'm definitely still a strong believer in PFM. I like to do PFM restorations. There's nothing wrong with, again, the right case, the right patients, or we have to choose the material for the right situation. Yeah. So when we move forward with monolithic Zirconia reconstructions, many people think, or when I go into discussions with my clients, well, monolithic is non-aesthetic. Yeah, there is no porcelain layered on, and so on and so on. And I have to say yes and no. Yes, we definitely have limitations in monolithic materials because we cannot adjust color as we can with, for example, layering with 8 or 10 or 12 different porcelains on one crown. What I still like to do, but we certainly can do. We certainly can match colors pretty well nowadays with our modern Zirconias. I want to just take you guys through a travel around my cases, what I see on a daily basis, basically, and how I do that. So again, monolithic aesthetic, I think that's definitely possible to have an aesthetic restorations with a monolithic material. So let's just move forward. So let's just look at this, I will say, fully digital crown. It is a monolithic Zirconia seated in a patient's mouth, and not done by me, for sure not. And I would not say that that would be a very aesthetic result. It will be it is a very functional result. The crown fits perfectly, contacts are spot on, function is great, occlusion is good. So that patient definitely gets his problem solved in terms of there is maybe a cavity, we do a preparation, or the dentist does a preparation, we solve the problem with the crown. But for me, that is nothing aesthetic. Yeah? So now when I look back, I remember if you saw me lecturing, I showed this slide, exactly this one already a while ago, and I was kind of going over this in social media, I saw a post looking for a very affordable lab to make posterior zirconia crowns. That's what I get in mind when I see this. Yeah, so and I remember the post was very long and a lot of comments on the post, of course. And for me, always came to my mind, oh wow, well, let's ask that doctor if he would send his patients, or not his patients, his kids actually, to that children's club, looking for very affordable children's club to send children and to send the kids to for the daycare. So I don't think so, right? I mean, none of us would send the kids usually to a children's club like that. So, and then you see parallels there, because when I see parallels, myself, my doctors, they're sending their grandma, their mom, their own case to us, but not the other cases. They go somewhere else, maybe even offshore. I think that's the point where we have to say goodbye to that result and go more maybe towards to something like this. Yeah, and that is, for example, a HT plus, yeah, Zolid HT plus zirconia full contour, just stain and glaze, and that can be pretty aesthetic. Yeah, and I did this case with Dr. Miles Cohn together, and it's on the pictures a little bit high in value, but to be honest, that also can be the effect by flashing of the light and so on. So, but it is definitely an aesthetic result. Yeah, it looks natural. It looks like a tooth. It doesn't look like a crown. And that's what I share with my team here. We don't want to do crowns. We want to do teeth, right? That's our passion, our profession. Yeah, here again, light is a little bit better here, and the crown really blends beautiful in that whole arch. Yeah, that is a tooth. That is not just a restoration. And I think that's what we're looking for. Or here, the full digital restoration, I call it always with the human touch. Yeah, I would like to give my reconstructions, my teeth, my crowns, the human touch. They shouldn't look like fresh out of a vending machine, just polished up or quick glaze on and that's it. No, I want to create something natural. Even if it's an OM1 or if it's an A4, it has to look at some point natural. And just looking at everyday dentistry cases like this, also a case done with Dr. Miles Cohn, and then he did these phenomenal intro pictures. He's just fantastic in there. So just looking at this, that is a tricky case, yeah, because that is not a OM1 case from the supermodel from South Beach. No, this is your neighbor. Yeah, that's your everyday dentistry. That's bread and butter. But it's an anterior case. You don't want to have people seeing his bridge in his mouth later on and say, "Oh, you have a bridge? Oh, wow. Okay, looks okay." No, you want to have actually that patient with new teeth that people even don't see that's a bridge, or even don't see that he has maybe there kind of something artificial in his mouth. But one problem here is we have two different preparation stump shades. Yeah, so you see one is more gray, the other one is more yellowish or brownish. So managing that, we have to utilize a material where we can mask underneath colors. That's very important. So with that material, we could not use a Zolid FX, for example. So we could not use a cubical zirconia. Why? Because that zirconia is too translucent and would actually transmit the underneath color to the outside. We definitely want to avoid that. So here we choose actually HT plus for layering. Yeah, so we have to, when we look at that kind of adjacent teeth with all the grace lines and the translucency, we certainly have to layer some porcelain on this. In full contour, that will be very, very tricky to solve. So here we decided to do a framework in Zolid HT plus that allows me to mask the underneath color because it has a little bit more opacity as the FX. And I can now layer nicely porcelain on top and get actually a pretty good result. Yeah, when you here see the bridge in different angles, I also added a little bit of a pink papilla in between here because he had some recession, and that's how it blends in. And like I say, it blends in. I mean, this patient has most likely 25 different colors in his mouth. So for me, that's even more difficult to match something or blend something in than if it's just one or two colors. So I think the result is definitely pretty nice. Yeah, it blends in, it looks nice, and when you see the patient here, you wouldn't tell that's a bridge. Yeah, it's his character, it's a mustache, and has this different colors. That's everyday dentistry. Or something like this. Something like this is maybe not a Zolid HT Plus case. That is something more where we need something more translucent. Why? It's so dark, right? Yeah, but the underneath color will be the same and be replacing these two premolars here, what you see. And so I choose here actually the Zolid HT Plus in multi-layered. Yeah, and the patient expectations were just copy what I have. Yeah? So that was kind of where we're going from, and that's most likely the biggest challenge. Yeah, copy what I have. Okay, let's copy that. And so we went through a design process in full contour and then milled it in FX, solid FX, multi-layered, stained and glazed. There's no porcelain added to that. And it really blends in very nice. I was very happy with the result, no question. And so the patient as well, of course, but you also see the distal molar crown. That is something we saw on the very first beginning of our presentation, very opaque, very artificial looking. That is something what we do not want to achieve. And just compare the second premolar with the first molar. These are both full contour zirconia crowns, yeah, just different materials. It all comes down to material choice, and of course you're handling it. Yeah, how do you handle that material? How are you able to handle the material? That's very important. When we go furthermore to full arch reconstructions, yeah, so I personally prefer, usually if you do something like this here, it's a full arch on the patient's left side. The screw retained bridge with the cantilever is a temporary, so don't judge me on the color there, please. It's just a temp. On the other side, these are 3 screw retained crowns in HT plus monolithic, and canine to canine is Zolid FX. Yeah, so I can also combine different zirconia materials together for different reasons. Yeah, for here, important for me was strength and stability on the posterior area because of the patient's occlusion, but I still wanted to have something more translucent because in the anterior area, because the patient does not have any discolorations on his preparations, no root canals and so on. So I could use a more translucent zirconia on the material. Yeah, the advantage on the FX is just in compared to lithium disilicate, in my mind, when we go digital and mill everything, I have a multi-layered material. On the lithium disilicate, usually I have one color. Yeah, and I have either to layer the insides or I have to glaze and stain a lot to get kind of these gradients, this gradient effect. I know there are multi-layered blanks out there or blocks ingots you can press, but it's just more tricky to do that. So I personally really like the ability to be able to just mill out of a multi-layered blank basically my crown and have a very nice result, a very economic result especially. And that's the same case seated in the mouth. Now we're doing the lower here is in temporaries, so that's the next step what we're going to do. So how to make a monolithic restoration pop? And pop, I mean, with what are we utilizing to make that restoration look natural with these effects? And these effects are usually built out of light. Light is a very important effect, and texture. Texture, I'm a texture freak. I can spend hours over hours on one crown in anatomy and texture. I'm, for example, I'm believing in to say if we do 7 and 10, if the shade is at 100% spot on, if the texture, anatomy, and everything is spot on, the patient would most likely not catch on it, on the shade, on the color. Yeah, and with texture and anatomy, we have just 3 basic shapes or 3 basic anatomy kind of points, which is the red and red to the line angles. We have the horizontal lines here, the tooth grows basically, and we have the mamelons. And I always tell my team, don't go overboard. Yeah, you can make it very cheesy looking if you go totally crazy on that, very deep and very playful. It can look very cheesy. Yeah, so less is more. You want to have some anatomy and texture, but you want to almost have it disappear. That's actually the art on this, like here. Yeah. Usually I would ask who can catch the crown or the veneer, but you guys can write down an answer so fast. I'll just tell it you. Number 10 is a veneer, and everything else is natural dentition. And I utilize in these powders or these lacquers basically just to not getting disturbed from different colors like stone or ceramic in anatomy, just to match it perfectly to my anatomy and texture, and then I can remove the color and can take care for the crown to finish or the veneer. Here, this is monolithic. That is actually solid FX, multi-layered. There's no porcelain added. Firstly, patients usually don't have a flashlight in their back, so it's kind of, but it's a good effect to show how translucent zirconia actually can be. And anatomy and texture, again here, for me, very difficult are always lower incisors. They're just very difficult to have them appear very natural. And I think this looks very nice here on this anterior bridge. We see the line angles, definitely. We see kind of little lines, horizontal lines and stuff. So that comes out very nice. Also very important, especially on implant construction, reconstructions, is tissue, gingiva. And gingiva, as you see also here, has to be very lifeful, has to be very nice shaped and a nice texture to it. Otherwise, it looks very, very dead. So always something what I would like to address. Important is just to look at, we have to polish, manual polish zirconia in the areas where we have function, occlusion, or touching natural dentition, because a manually polished zirconia does not wear as much as feldspathic porcelain or non-polished zirconia. Non-polished zirconia can be very abrasive, so we have to be very, very careful with that. Or even chrome cobalt alloy is also very abrasive. So we have to be very careful. We definitely have to polish the area where we are functioning over natural dentition, to avoid any strong abrasion on that natural dentition in the future. So when we talk about implant cases and implant dentistry with zirconia, I just want to show one case I just finished with Dr. Knack in Pennsylvania, close to Philadelphia. We finished that case, and I want to show here the advantage on the Zolid HT Plus, what I utilized for that case. Just two simple posterior implant crowns, but I personally think we also have, I don't know, I would like to always give my posterior crowns the maximum aesthetic as I would like to do the anterior crowns in shape, in texture and anatomy. On this case here, what I definitely enjoy to do is also utilizing pre-shaded blanks, and that's a very big factor in terms of economy. You save just tons of time if you can utilize a pre-shaded blank, and you don't have to go back after taking out the milling machine, contouring, and then still coloring your zirconia. Yes, I do that as well for certain restorations, but usually for individual crowns, I utilize just pre-shaded blanks. And with the HT Plus, we have all 16 Vita shades available, which is fantastic. There's no guesswork. There's just taking the right blank and moving forward. That's definitely something I definitely enjoy. And I think the result in this case, just even two posterior crowns, is definitely nice. Here the crowns are glazed and ready actually to go, ready for the big show. Here in the model, a different view. And then here we see the case seated. You see also multiple different colors, but it definitely blends in nicely, as good as we can. I mean, you see there's some tissue recession, so we definitely have to take this as well in consideration when we look at the case. But for a monolithic material, that's, in my mind, not bad. That definitely we can definitely look at that. Here another case, just also that is a HT Plus case. Looking here in this R-squinting crown, and also looks very nice. Digital dentistry, of course, that's just a couple snapshots out of my daily life, basically what I'm doing. This case is a combination, again, about implant crown, tooth-borne crowns, anterior restorations, or two anterior crowns. These are layered. The facial, the lingual is just full contour zirconia, and these are all HT Plus. So I utilized HT Plus here when I was layering the crowns, and then also HT Plus for the posteriors, just stain and glaze. You see here in the anterior crowns, unfortunately, they're not very detailed, and usually I like to do more anatomy in the lingual. I choose this case to show you that I was not happy about the case, but I also could not do anything else because the patient and the doctor requested a very smooth and very non-very playful lingual anatomy, so literally no anatomy. So I personally don't like that. I think there is a need for anatomy lingually, also as a give your lingual a little bit of love. Yeah, sometimes we just have to follow instructions, what we're getting for our customers. So that's a case I did very early on when HT Plus came out. It's an anterior bridge or anterior crowns, block crowns basically, just full contour zirconia. There's no porcelain added to that. It's just colored basically. That was white HT Plus and then hand colored with the ceramic liquids, and then with the GC luster paste glaze, staining glaze. I want to address a little bit kind of material specifications. We have our very, very strong zirconia with around 1300 megapascal. I would say translucent, I would now say high translucent zirconia, which is the HT Plus with around 1200 megapascal. And we have the high translucent zirconia, the cubical zirconia, which is the Zolid FX. And these are between 650 and 750 megapascal. So in terms of megapascal, it's always it's a numbers game, to be very honest. And to go into the numbers game, what does it mean 650 or 1200 megapascal? It means that actually that material is a lot more strong than our natural teeth. Our natural tooth strength is 130 megapascal. And so if I look at this and think about this, oh wow, and then we're looking at 650, we can think, man, that should be enough to do everything actually, right? But it's not, because we also have to imagine our regular dentitional natural teeth, they are not blocked, they're not connected, they don't have bridge pontics and so on, they're just individual teeth. So we definitely have to take that in consideration, that we still need some very strong materials to actually bridge certain areas or make something more strong if we have a collapsed bite and so on and so on, if we have to trick nature. Yeah, that's just how it is sometimes. Just to point out, the HT Plus, for example, is utilized in my laboratory for almost everything, yeah, from single crown restorations up to full mouth rehabs. And you see here an example of a zirconia hybrid, which is basically full contour in the posterior area. And I always layer my full zirconia hybrids in the anterior area just to give it a little bit of the kick, and definitely pays back. The advantage, I just have a very, very strong framework, over 1200 megapascal, which is definitely enough for a full arch or full mouth rehab, but I still have a nice translucency to have a very natural look. By the way, just go back very quick here, and you see the blank blending in here, and you see Zolid HT Plus white. So the Zolid HT Plus is available in white or in pre-shaded blanks and all 16 Vita colors. For me, a full arch case, I usually mill in white because I want to customize the color. And you have to imagine if you nest this in your matching software, and you have to tilt it a little bit or to tilt to the other side, and you have a pre-shaded blank or a multi-layered or something else, it can affect basically your color. So I usually do white and hand color the case, just to get also more natural look into this whole thing. Here, the finished case, upper lower zirconia hybrid. The lower here was totally full contour except with the pink. The upper was just layered for the insides, for the anteriors. I want to show here very quick, that is the Zolid FX case, more translucency. You see in the light transmission through the crown, but also I want to just show here the anatomy, as you see how important anatomy is when you look at the left side of the left picture, how aggressive that line angle comes out here. That is so important, yeah, to really match here and match another tooth, basically, to really try to match it as good as possible, to copy the other side, basically. Yeah, even if you say a human is not symmetric, which is right, but we still have to keep in mind our restorations are blending in nicer, as symmetric as possible, with a little bit of tweaks here and there, of course. Yeah, here that picture again, that's the HT Plus. That was actually one of my first case with the HT Plus when it was still in beta testing, and I was very, very happy with the result. You see here one crown is always already glazed, the other crown is just sintered. Yeah, so very nice result, very nice material to work with. I was pretty thrilled and gave that feedback back. And here, just HT Plus layered, just facially micro-layered basically, and in size, you see some kick to the translucency here, which is definitely nice and fun. So now I want to just go quickly to a design process of a case like this. So we have our entering screen here where we choose the restoration, anatomic crown, and pontics and antagonist, and we go through the design. Yeah, so here I made a bridge design full contour, you can tell you can go pretty aggressive in size of restoration. That's a 6-unit Zirconia bridge, yeah, with pontic areas in the posterior. I have a problem doing this with that material. So I always design full contour first. I go from there basically, and then I start looking at the case and cutting back the areas where I would like to layer porcelain. I'm usually choosing the Knut Miller library to cut back. That also is very economic because I can actually then characterize with some glaze kind of internal stain mamelons, and I can use less porcelain. And I do that on here on the lateral, and I also do that here in that case on the canine. Yeah, you see here same cutback, but it's a minimal cutback. So I do not usually layer a lot of porcelain, thick porcelain on Zirconia. I try to avoid that. I can then go through a free-forming process to kind of refine a little bit my coping shape and my anatomies. And here, just a different view. I have a nice finish line on the canine on the lateral. Yeah, that have a nice transition basically to the porcelain. But also you can tell my connector strength here in the posterior and the pontics. It's pretty rigid. Yeah? So I definitely have to make sure I have enough strong restoration, yeah, or enough strong connecting area where the bridge pontics are, especially also mesial and distal of it. Well, that's usually the area where it breaks. From here, I can then go over. Again, I can go back to my freeform mode and can smooth out these connectors a little bit. They're not too humpy, yeah, so make them a little more organic shaped, and finish up the design, and we can nest it. Yeah, here that's a different nesting, a different case, but what I want to show you the nesting strategy. Don't go overboard with connectors. First of all, especially to your supporting blank in the middle. I utilize usually 5 to 6, usually for the upper 6, for the lower 5. Time-wise, I cannot go deeper into that. It would take another hour most likely, but just keep that in mind. 5 and 6 connectors to the supporting blank. You also see the supporting blank, the placement of it. It's not too close to the restoration, but also too far. So it's just kind of, I would say it's kind of 5 millimeter, 6 millimeter long connectors, yeah, and that gives enough distance. This case is totally wrong. Just want to show this, the other extreme. Yeah, there are just too many connectors to the supporting block. Yeah, so I normally remove the last 2. I don't use them, and that is the lower arch. I usually use 5 for the lower arch because the lower arch is more straight posterior areas. I don't have to go so far back with supporting connectors to this supporting structure. And then I was just want to go through here. It's a little video about basically the contouring after milling. I always contouring my green state zirconia. There's no way that I would not do that, just to give it the last kick, to make it a little bit more organic looking. Milling machines are, especially with our HD modes now in 5-axis milling, we can utilize these machines phenomenally, and they will give us a incredible result. But to be honest, I'm still missing the organic, the natural kick, and I'll always give that with my bare hands basically for a couple minutes. I don't have to go crazy for 2 hours contouring, but if I utilize here 5 minutes on the 600 bridge, I think that's definitely valid. Yeah, so I use usually a rubber disc, the diamond infiltrated, or a very thin diamond disc, just to open embrasures a little bit more, to shape it here and there, to even make it imperfection if I want to. Yeah, just to avoid that it looks too perfect. Yeah. And then we start with the infiltration technique. And the infiltration technique, I'm utilizing the Ceramic Liquids new formula. I utilize basically just these, the new formula. I don't utilize the FX liquids because for me that's a liquid one for all. I can utilize that liquid for all my Gilbert zirconia. Very nice, very easy. And I want to just go here to another video where we can show how to set them up with the marker colors. I use also the Ceramic Liquid Eye to show basically what kind of, where I already colored and where not, where I have to go over still. It keeps me a little bit better control over my coloring. Now you see here, I'm putting now some dentin on here, and the control factor is very important, especially on bigger restorations. It's very easy to get lost. Yeah, okay, how many times did I now paint A2 in this area, or on all my 12 teeth? Yeah, so that keeps me definitely on track. and avoid that I'm losing control. When you guys watching the video, that's actually a good moment actually to go through some questions. If Richard can read some questions. If there are questions, I'm happy to answer them now as long as we watch the video.
Yeah, thanks, Alex. Those are great pictures, fantastic designs, and love your structure and how natural everything appears. We had only one question so far from Terry Sickler. What kind of stains you use? I saw you mentioned that already on there. I know you're KOL for GC, but is the initial the only kit you're using? Is there anything else?
Yeah, so I'm using the luster paste. This is my basic glaze stain kit, but also using now I used to use the in vivo stains for some special characterizations here and there. They're a little more prominent. But also now I'm using the spectrum stains. I just got a kit from GC to play with, and it's phenomenal. I'm very happy with that kit. I always posted some cases on social media. I'm very, very happy. And I'm now combining luster paste with spectrum stains together. I'm actually starting mix and matching them, and I'm super, super thrilled about that. The results are pretty incredible.
Okay, thanks for that.
So
I have to look. I haven't seen that one yet.
Yeah, it's pretty awesome. I love to use that. And now here, by the way, since you just have one question, I can talk about the coloring here now. So you see I'm setting up my tray. That's what I usually do for a bigger case. I'm laying out my colors and then putting my marker colors in here. It's almost like basically I would set up my porcelain tray with porcelain or my glaze and stain tray with stains. Yeah, it's the same thing. You set up your colors. Usually I'm writing it down where everything is, or I put the bottles in the right position and make a quick iPhone picture or smartphone picture. So here then I mix it, of course, yeah, that we have everything good saturated in there. And after mixing all the colors, I basically start painting the colors on my framework. Yeah, here's the 600 bridge again. And usually I start basically with the dentin, and I go with the dentin one time over the body, or in the proximal first with the darker dentin in here and on the neck basically. And with the colors, it's this thing, it will get more prominent as long as you go over the same area. Yeah, you see here, I know doing the occlusal area with the darker dentins, I utilize usually, for example, if I want to reach an A2, I utilize A3 for my occlusal areas, for the interproximal, and for the neck, for the cervical area. And then usually I go with the A2, again over the cervical area or the whole body, and then I go a second time with A2 just over the lower body and the cervical area, and the third time just over the cervical area. So I have these 1, 2, 3 layers basically from incisal down to the cervical. And then I start utilizing my incisal colors. Yeah, that's very, very important. And then certain effects, a little bit orange sometimes, but very, very careful. Just the tip of the brush dives into the orange. It puts a little dot in the middle because the orange is extremely prominent. Yeah. Because time-wise, I have to move forward, so I will just move forward from this here. We'll show you the final staining or the final coloring here. Basically, it's very colorful. The blues and greens are incisal colors, enamels basically. The red and yellow is more the dentin colors I'm utilized here.
Alex,
here another. Yes.
We have 2 more questions. I think one you just perfectly answered, which was how many brush strokes do you do for the Zolid HT Plus and the new formula? But maybe what could be added to the question is if you make a difference in how many applications you do in between the different materials, what your experience is in the use of the new formula. And then here also another question about how you mix up your orange on the new formula, if 20% orange, 80% dimmer sounds right to you, and if you make your own shade guides for the new formula liquids.
Yes, so a lot of questions, a lot of answers. So let's start with the strokes. Yes, it's 1, 2, 3. Yeah, we answered this already. In compared to the Zolid HT Plus and BFX and the regular Zolid, which I don't use anymore, there are definitely differences. For example, the FX needs much more color, much more intense color than the HT Plus in my experience. The Zolid needs less color than the HT Plus. So that's kind of my experiences. So I excuse that with the raising translucent level, we're getting kind of less prominent colors or less intense coloring. So we need to apply more, basically. So that's kind of more darker color. So sometimes I can just utilize an A3 instead of an A2 if I want to reach an A2. It also, I realized, it all comes down to techniques a little bit. Every technician is like glaze and stain. You have to develop your own technique in coloring these zirconias, and that's definitely what I realized. You can teach that, you can learn it, but when it comes down to the bottom, you have to just do it, and you have to go through a process, and which is pretty easy. It's just doing it, yeah, and learning it and getting your own process done. For what was the other question you had for the coloring? I'm trying to remember now. It's a lot of things. Richard.
How do you mix up the orange? If 20% orange.
Yeah, so I utilize the orange very, very rarely, just a little bit. And as Richard mentioned, I use 20% orange and 80% dim liquid because the orange is so aggressive. Yeah. Same with the gray. The gray is also used. I use around 30% gray, 70% dim liquid. That's what I usually do. I utilize for the other regular colors, dentin and incisals, pure. I do not dim them down at all. Yeah, so violet and dentins are pure liquid. If I now go after the coloring to sintering, you see here speed, thermal solid and solid FX speed. I do not use speed for anything more than 1 unit. So individual crowns, yes, I do speed sinter sometimes, but also not more than 3 crowns in a sinter tray. So I'm very careful with speed sintering. For me, zirconia is a very sensitive material, very good material, but very sensitive, and has to get treated extremely careful. So I'm very careful with speed sintering. Usually I use the regular program number 2, or even for big case number 3 on the thermal therms. It's kind of a 14-hour cycle what I'm utilizing for big case. For that 1600 bridge, I definitely use a very, very long sintering cycle, just to be very kind of sensitive to the material. And you see here that that's the sintered result. You can see a nice translucency and incisal. You can even see I put a little bit of pink on the pontics, just the hair a little pink, to have a nice transition to the tissue later on, that it blends in nicely. That's a good result now, ready for glazing. Yeah. And just as an example, big case is a full arch bridge here, a little cutback. Just want to sneak in a little screenshot here. And then after sintering, we go over to porcelain layering. I show here a full arch case. I'm trying to kind of not doing too many bakes. Usually I'm down to 3 bakes, that's it. Yeah, so the dentin, then I'm usually putting the pink already on there in the first bake, at least a little bit, and then I do a correction bake and then a glaze bake, sometimes another glaze bake. So I'm trying to have as minimal bakes as possible, basically. Yeah, and then we have the final result here. For furnace cycle, porcelain firing cycles, I'm lowering my heating rate a lot, and my cooling rate I'm down to 25 degrees a minute. So I'm very, very careful with that, and depends on your porcelain, 1 or 1.5 minutes for holding time. You can lower your temperature a little bit, because as long as you have it in the oven, it's porcelain melts more. It kind of gets too glassy otherwise if you're heating so slow and cooling so slow. So I lowered my final temperature around 12 degrees. Yeah, so I discussed with Peter Pizzi. Actually, we had a nice talk about that, and he was right. He told me, well, if you do, you have to go down with the temperature, and I tried that, and I have definitely better results. Yeah, so my porcelain's not as glassy anymore, and it looks very, very nice as orange peel surface. But you definitely have to lower the temperature when you lower your heating and cooling rate. But that's crucial to lower these timings. Otherwise, you stress the zirconia, and you can actually create micro cracks. And we definitely want to avoid that. And that's the final case, just a full contour zirconia, full mouth rehab on implants. The anteriors here are a little bit layered in the upper. The lower is full contour, just glaze and stain. Just some impressions. Here, a typical case just to show how the HT Plus is versatile. That's basically not a hybrid, it's a crown bridge case just with the screw-in crowns and pontics, yeah, so upper lower in full contour, micro layered.